Yeah. Online schooling. So we welcome everybody to this discussion. I'm Dr. Sujatha Thyagarajan. I'm one of the pediatric and PICU consultants based at Aster RV Hospital, JP Nagar. And I will be moderating this session today. It's a very important phase that we are all going through at the moment. And we're all learning new things and unlearning a few things as well. So it's a good idea to actually get a 360-degree view about online schooling, which now everybody has become very familiar with. Probably a year ago, we hardly kind of, knew about it. So I'm going to start introducing our first panelist. Our very special guest is Sophie. Sophie is 7 years old. Sophie, do you want to tell something about yourself? You want to unmute yourself, Peter?
I cannot find her on the call.
Yeah, she's on Redmi.
Okay.
Yeah. So unmute yourself. Yeah.
You can click on the button, Sophie. You have to click on the button. I've asked you to unmute. Yeah.
Good evening, everybody. I am Sophia, 7 years old. I am a class 2 student studying at Nirmala Rani English Primary School.
Very nice. Thank you, Sophia. Well done. I'm going to move on to our parents. So we have Mrs. Pramila. Can you please introduce yourself?
Hi, hello everyone. My name is Pramila. I've done my engineering in electronics and communications. I'm the parent of 11-year-old child who is studying in DPS South.
Wonderful. Welcome to the session.
Yeah, thank you so much.
Next, we have Mr. Jai Ganesh, who is also a parent representing the parent body here.
Thank you for this opportunity. And hi, everyone. Good evening. My name is Jai Ganesh. I work in the digital transformation area in a captive bank here on the Outer Ring Road. It's called Danske IT. And I am the parent of 2 kids. My elder one is in the PU second year, and my youngest one is in 9th standard. I also have an extended family. My brother is also staying along with me, so their kids are also as good as mine. So my brother's younger kid is in the second year medicine in BGS, and my brother's second daughter, she is doing her 10th standard. So we have 4 kids in the class in this house doing online. So the house is definitely full of audio, videos, and all this stuff. So thank you so much for the opportunity.
That's a bigger challenge then. So it will, we'll be very interested to hear from you about your perspective of how to handle all of this as a parent.
Sure.
We'll welcome Usha Mohan, who is representing the teacher body here for the discussion today.
Hello all, I'm Usha Mohan. I'm a school teacher in a reputed school in Bangalore South.
Welcome, Usha. Thank you. And then we have a popular pediatrician from our South Bangalore, Dr. Shalini Rao. Can I please request you to introduce yourself, please?
Hi, Nan Dr. Shalini Anta. I practice in South Bangalore. I have a special interest in child development and neurology. So I am also a parent of 2 kids who are also doing online classes. So my anxieties about schooling are pretty much the same as any other parent. So I'm quite interested and very happy to be in this meeting.
Wonderful, welcome. So
Thanks.
as we discussed, the purpose of this meeting is to basically get a 360-degree view to try and understand a little bit about this online schooling. So as everybody is familiar, we've now kind of got used to the fact that we are going to look at the screens, we're going to look at the images, the videos, and then, interact with people. That's the only way we know about various people. In a way, it's good. In a way, it's like, challenged us. So what we'll do in the next few minutes is to go through what's gone well for us. That's what we'll focus. So we'll start with Sophie. Sophie, do you want to tell us a little bit about how you're enjoying or about your online school? Do you like it? What do you think about it? I think your sound is not on.
The sound is on, but some tech error. You can mute and unmute yourself, Sophie.
Unmute. Yeah. Oh, we have some problem there, huh? We can't hear you. Okay, while they're trying to fix that, Sophie, we'll just ask Usha what she thinks about online schooling. How is it different? How is it going?
See, basically for we teachers, it is a boon actually, because we are able to manage both home as well as the school with ease, because the time management is excellent here. We can jot up, and make full justice to both the sides.
Wonderful.
So that is how we are taking it on the very positive front. But yes, of course, there are few constraints that we have to plan very well for the day, and the time excellently done. We have to do that. Otherwise, in hardly 40 minutes a period, we have to get through it.
Yeah. Yeah, thank you. This work-life balance is quite a challenge, and I think this is a real positive thing.
Yeah.
I wonder what as parents you felt. I'm going to ask Mrs. Pramila first.
Yes, ma'am. Yeah, like I have a few suggestions, and I would like you people to give me the suggestions about coping up with the online classes. Because children are facing a lot of troubles because network issues are there. And one more thing is they are unable to concentrate on in online classes, and health issues regarding the health issues also. So I feel I would like to ask you, the doctor, can give us suggestion about the health first, and then as it is, children are not feeling very lonely when compared to offline classes. So
is anything going well for you as a parent?
Yes,
That your children are actually doing online schooling.
Yes, I feel he's at home. Main thing is traveling is not there, no traffic issues. We don't have those tensions. Otherwise, he's doing schooling at home. That's a comfortable thing for us. Otherwise, what is like staring at the screen every time, I feel his eyes are burning and a lot of complaining about the headache. So that is, I feel that is one disadvantage.
That in a minute.
Yeah.
We'll talk about those in a minute.
Yeah.
So you feel watching your child study and avoiding all the traffic blues is a good thing.
Yeah, that's a good thing.
So far.
Feel, yeah.
Excellent.
Yeah.
Mr. Jay, what do you think?
Okay, I came with an open mind that, okay, I will hear a lot of negative vibes about online schooling, but I'm so happy that everybody sees this as a positive aspect, actually. And so do I as well, by the way. Being in an industry which is putting forth a lot of digital innovation in the banking industry, I am very much looking forward to having this disruption in the way this online schooling has happened is such a big boon, I would say. So every major issue that happens once in a while will bring in some innovation in the society. And this particular time, I think this online schooling is a big boon, I would actually say. Primarily because it is my view that while the kids are at home under the parental guidance, where the parents will also take a more initiative to help the kids be at ease and also follow through what exactly the curriculum and also the subjects are being taught about. But also at the same time, they have you can just switch off when your classes are over and immediately get into your playground as such, right? So where people have the possibility. So that is a big boon, I would actually think so. Another aspect which I also think is this digital revolution also gives a lot of other possibilities, right? So when teachers are actually teaching some of these concepts, they can at the same time also go to other sources to make things even more easier for them. I've seen my kids actually trying out in other social media, for example, a simple Pythagoras theorem that the teacher teaches can actually be taught in many, many different ways. When I do not have the possibility to ask that question again and again, because of many different reasons, maybe the network is not correct, or maybe everybody needs to have a chance. So I've seen my kids actually going to other places and also understanding things. But in a physical environment, they would have ended up only asking the teachers. But now they have the possibility to also explore otherwise. So shortly, I would say this is definitely a boom, but maybe I can also go through other things at a later time. So that's my short answer.
Wonderful, wonderful. I mean, it's very encouraging to see that, we're seeing we're able to get a better perspective for our children. Just because we've opened up a new venue or opportunity for them to explore their knowledge and their learning. So that's wonderful to know. We'll see whether Sophie's network is better, whether the sound is going to come through, Sophie. Oh, we're still not able to hear. Maybe you can just disconnect and then reconnect, I guess.
Yes.
Yeah. Whilst we are waiting for Sophie, we'll ask what Dr. So we'll just go through some of the positive things. We'll ask all our audience to actually type in the chat to tell us what's going well for you. You may be a parent, you may be, a student yourself, or a doctor. We would love to hear from you what good things are going on because your child is on the online schooling. And I'll request Mayur to actually just keep an eye on that chat box to tell us if there are any new things that is going on. Oh, we're not still having Sophie on. That's not fair.
Ma'am, can you hear me?
Yeah, wonderful. Go for it, Peter. You tell us what's going well.
I miss my regular classes as well.
Okay. And
I am able to attend the classes at the comfort of my house.
okay, that's good.
I can concentrate more on what teacher tells as I sit alone for the class. I am able to finish the assignment given at my own time.
Oh, okay. Wonderful. Okay. Do you want to say anything else? You're having help as well from home, right?
I miss interacting with teachers and my friends.
Oh, yeah, that's true. We do miss that, right? Yeah.
Yes.
There's a good thing though. The teachers can't like reach you, get you to do things that you don't want to do. Huh?
Yes. Yes.
Wonderful. Okay. So there's some things that are coming up in the chat box, right? Let's see. There's Nandini who is telling us, teachers and students are leveraging new methods to learn better. So more time with family, no time wasted in transit. Wonderful. And there's Mrs. Akriti telling my child has never seen physical schooling because she started with her nursery schooling 2 months back. and she's not sure how confident they'll be. Yeah, that's a real thing. So we want to know how to boost their confidence. Yeah, we'll talk about that. Most importantly, Ms. Ruby is telling us that the child is safe at home. Okay, and that's a very important thing. Okay, but the social circle and the other activities are being missed. Sneha is telling us it's very difficult for children to understand about practical classes. So showing YouTubes won't work much. Yeah, fair enough. Yeah. Anything else going very well for your children because of the online schooling? I think we have to give it to say that, it's opened up on some new opportunities for us. And yes, this is somewhat the new normal for us, but in a way we have kind of dealt with the challenges. The learning has never stopped, and that's what is most important for us. I'm going to just move on to the next things. I know lots of anxieties and worries have been there because of this online schooling, so we'll kind of touch upon that. So Usha, you have always done offline school. Maybe you had an opportunity of like maybe twisting the ears. No, I know you're a super cool teacher. You wouldn't ever think about that. But I'm just thinking, so how different is it from the offline to the online schooling? How did teachers kind of, what challenges did
See,
they have?
there are many aspects here. To be very frank, see, online is much different from the actual physical presence in the classroom that we conduct offline. Okay, that major thing is, see, here online we cannot monitor everything, because in a class of 40 we cannot monitor all the 40 of them. See, one child might switch off the virtual video, and even he can sit on the bed, might pretend to listen. See, we can't do that. So that might be a negative part of it. Or the positive part of it is, we try to give lot of worksheets and many questionnaires that we put, so that they are prepared for the class. Either we try to recap what we have done in the previous class, or we try to questionnaire them in the further more topics that we are bound to do. So this peps them to keep them more active inside the classroom. This is how we try to deal with them.
Wonderful. Yeah. So, I just wanted to hear from Mr. Jay. What do you think are the challenges that parents have? I can see a few things that are here being shared in the group as well. I'll just wait to hear from you.
Yeah. See, my thought is that, okay, all the simple concepts doesn't really need a physical interaction with the teacher. They're small concepts which can just be downloaded from the digital media. They can definitely be taught just over the digital medium as such. But what I definitely think is missing is those practical explanations or group discussions, for that matter, or research-based discussions, which will definitely be much better if people do come together, or students come together. So that social connect specifically to learn from each other is actually missing out in this way as such. Though there is definitely a lot of positives, that simple concepts can definitely be taught over the online medium, but getting together with friends and then sharing the knowledge and then learning from each other, and then doing these research-based methods is definitely something which is missing. As we grow into the larger, higher classes, and those becomes even more important. Other than just the theoretical understanding of concepts, you need to also use the practical methods as such, and get into group discussions. So that is something that I see is missing, especially for my son who's in the PU second year. So while it cannot just be bookish, right? So there is an online teacher who teaches, and then he goes to other mediums to understand things even better. But when it comes to experimentation or discussing or group discussions, and what I know I can teach you, what you know you can teach me, or learning and sharing, that is definitely missing out. That's definitely which I think is a miss from an academics perspective. And I also think two other aspects, body and also mind, right? So just like how you have this BMI index to capture how exactly the body of a particular person is on the positive side, or is it affecting on the negative side, I also think we could also have the body, mind, and academics as a particular aspect that can assess how exactly are we using this online medium to the best possible. The mind is definitely affected. The concentration or the anxiety of not being able to talk to my friends is actually missing. And the body postures, or as the teacher Usha just mentioned, I don't know, sometimes they also feel that, okay, I don't have the right chair, so I can just stand up and take classes, or I can sleep on the bed and take classes. Absolutely not possible for a long time. So that is also something which is concerning, my 2 cents on what is not happening very good.
Very, very key points you have brought out, Mr. Jay. Just Pramila, do you have any other additional concerns you have?
Ma'am, in another 1 minute, we have to take our break.
Oh, yes. So what we'll do is at the end of 1 minute, it's just a reminder to all of us that,
Yes.
let's wait and see. Yeah. Sorry, Mrs. Pramila.
Yeah, what I feel is children have to develop strong attributes towards learning. Like they have to have focus when they're doing online education, because at least in the school, teacher will be there that that fear will be there in the class. But that time is when it comes to online classes, and child should be very responsible. So I feel that is a negative task when it comes to online class. And one more positive thing I would like to say is my son has become more digital boy. Like in that he can, even when it comes to network issues, he's able to do everything on his own. I don't have to sit with him, or I don't have to be at home
Yeah,
for
that's
that.
very, very.
So that's a nice
yeah.
positive thing I feel. Yeah.
Yeah. Okay.
Yeah.
I was just wondering, how many of you have had problems with, say, network during the online schooling, the power supply and everything. That's also a major concern.
Yes.
Okay. And there's Sophie raising her hand to say she's had all that. So we'll ask Sophie as well.
At times, I am not able to ask any doubts or questions directly to my teachers because
yeah, that's a big concern, right?
network issues.
But you know what? You did a fantastic job by raising your hand, so we could know that you wanted to say something. Does that work? Yeah. Okay. All right. What else?
At times, I feel tired seeing the mobile screen. My eyes are irritated.
Is it? Okay. Okay. Let's see what Dr. Shalini has to say about all these challenges. So, Dr. Shalini, we've had quite a spread of what the parents and the student felt about what's going well. There's quite a few people sharing their thoughts, even in our chat box is filled with quite a few things. I think there's now time for a break, a quick break, while Dr. Shalini comes back and tells us a little bit about, a summary of what as a doctor she feels. So what we'll do in the next 20 seconds, Mayur is going to play some music on. I request everybody to switch your videos on, but do not look at the screen. I want you to look at something that is 20 feet away, but have a happy expression as a statue till the music goes on. Okay, a quick break there. Mayur, go for it, for the music. I'm looking away with a happy smile. Where's the music on?
I think time up.
Well done. How did we do, Mayur? Thank you.
Very nice.
So that's a quick break for everybody. So the aim is to, at the end of every 20 minutes, we take a digital break. So we're not staring at the screen. And then, so we look at something that is 20 feet away. Okay, so that's the aim of this short break there. So it's a good idea to avoid that eye strain that people have been talking about for quite some time now as one of the anxieties. Okay, so Dr. Shalini, all yours. Please tell us. I think you're on mute still.
Okay. Yeah. Now, okay. So yeah, I totally recognize and identify with the concerns about online classes that everyone, parents and teachers have expressed. As a pediatrician, I have come across a few problems recently over the last few months due to online classes, as well as the lockdown, not being able to have the social interaction. Some of them are eye problems, dry eyes, which the ophthalmologist has confirmed with slit lamp examination, visual acuity, so developing nearsightedness or farsightedness, headaches because of online classes, and also posture related problems, and also issues due to lack of physical activity. So these, I have come across these. However, I also recognize that online schooling was the best option available in that situation. So perhaps we need to understand or perfect our, methods of using the online platform a bit better, and see how we can get physical activity into our kids' daily routine along with online classes. However, I think the purpose of school is not just information distribution. Information can be gathered anyway in this digital day and age. If I want to learn something, I can always, there are so many lectures available on the digital platforms, free lectures too. So there is no dearth of information around. So, but schooling is necessary for social interaction, companionship for kids, and developing conversational skill, and deriving a lot of inspiration from the teacher as well as the peers. So these aspects, and of course physical activity, sport, organized sport, there is no replacement for those. So those are the major drawbacks of online schooling as I see it. Information gathering is not so much of a issue these days for older kids. For younger kids, yes, making them sit down in one place, making them learn the basics can be quite challenging online. But in a slightly older kid, perhaps a high school kid, that is not an issue. I see other issues in those, including obesity in the last year. So I think from my point of view, yeah. Did someone want to say something? Yeah, I think schools, and as parents, I think we've got to arrive at a well-informed and up-to-date policy about how we are going to take this forward, our kids' education, our kids' childhood back on track. They are missing their friends, and that could lead to a lot of other mental health issues too. Actually, social interaction, even for adults, it is extremely important in this day and age. Even with digital connections, it is not as good as physical, in person, having camaraderie, just being silly together and just doing small things together matters a lot in childhood. So I think we need to arrive at a policy as schools and as a body of parents and a school, about what are we going to do with our child's education now that we know that we've had a year and a half of this pandemic, and we've seen how kids have coped in these two waves that we've seen in India and across the world. There is some interesting data which ICMR, the Indian Council of Medical Research, has come up with. So I think we need to look at all these aspects. What are we missing? What are we gaining with online classes and not having physical classes? And perhaps restart schools or see what is the best thing that we can do with regards to making a combination of physical and online classes, perhaps, and take it forward for our kids' childhood to be back on track, to avoid a lot of issues, health issues in kids, because it doesn't look like the pandemic's going to end anytime soon. Until most of the population is immune and either by passive immunity or actively vaccinated, it's probably going to go on even after vaccination. So how are we going to address this issue in the pediatric population, who has been the worst hit in this? They've missed out on a lot.
Agree. Thanks so much, Dr. Shalini. So a few things that we kind of can pause and think about. One is, while it came with lots of positive things about, a good work-life balance and, parents able to supervise their child's learning at the comfort of their home, learning literally kind of spread out, so the realms of learning has just expanded like anything. And it comes with its own challenges of like concentration, making sure that, you still facilitate this learning and, adapting to this new normal, and then coming up with these challenges of health related issues, which could be something similar to, something with related to eyes, with vision, with posture related changes and growth and obesity and poor activity and their comorbidities. So the spread is very high. It's like the two faces of a coin. But nevertheless, as what Dr. Shalini says, we can't escape this, and maybe there needs to be a regraded, way into getting back to school so that everybody is like, getting the schooling as necessary. And schooling is not just about knowledge, as what Mr. Jai was telling us. And, so although what Mrs. Pramila told that, children are becoming more savvy with the gadgets and learning to know how to get this information and everything, well, that is all good, So as what Sophie says, it's very hard that she's not able to interact with her friends and she's not able to tell when she wants to say what she wants to say during the class. And she would like to share her opinions and she's not able to do that because she has to wait for her turns. Isn't it, Sophie?
Yes, ma'am.
Yeah. So what would be something different that you would want to see in the next 3 months? Do you want the online school to continue? If so, how do you want it? Or do you want to go back to school because you missed that so much? What do you want to do?
I would like to go to classes at least for a half day.
Ah, wonderful. Yeah. So you want a bit of both. Yeah. Wonderful.
Yes, ma'am.
Okay. So Usha, what do you think we should do?
Yeah, actually, what I would suggest here is definitely we would like to, until the pandemic end, we are not given any choice apart from the online. If we are continuing online classes, it is like, we have to introduce few yoga and breathing classes in between the lectures, after 40 minutes. The next start should not be immediately. Now, if the child is reading or studying general science, it cannot be jumped over to history, civics, or geography. In between, they should have some activity classes like yoga, breathing, or just the normal, physical exercises classes, wherein they ask the child to do some stretching exercises online. See, all these things can be introduced so that the online classes, the child is being taken part as, as a physical activity also. So not 24/7 sitting right in front of the monitor. You can do some activity classes, some drawing classes. These ease classes should be introduced in between. This is what I felt, so that the subject's understanding capability for the children will be very excellent, and they are, it is going to keep them on toes also.
Wonderful. Yeah. Okay, Sophie wants to say something else.
I attend dance class in Tuesday and Thursday. Online.
Wonderful. And that's online, is it?
Yes, ma'am.
Yeah, see, that's wonderful. So, Mr. Jai, what do you think? What should be the way forward?
See, there is no going back to fully physical education. Even at the times of having a full school, we used to definitely see that kids have been going to tuitions or additional classes and stuff like that. And the advent of all these digital classes like Akash and Byju's and things like that, it is only quite positive that some of these concepts are even easily understood when you have a digital medium and also many different ways of actually teaching. So I definitely think there is definitely not going back to the physical for good. However, I completely agree with Dr. Shalini and also you, Dr. Sujatha, that there is definitely also an impact on how the kids come up with the communication or social interactions and being with their age group. That affects the mind a lot, for sure, no two doubts about it. Somewhere I just definitely think that, okay, we should have some sort of a reboot. I mean, after a class or after every 2 hours or something, there should be some sort of a reboot, so that it could be, as Usha teacher just said, it could be a small yoga exercise, or just like how you introduced a 20 seconds small sound and video, something of that sort. But one thing that I can also say is that, okay, because classes are happening online, students can also easily open up a Google Chrome and then go into something else also at the same time. So they are doing multitasking. And I'm sure teachers can't really find out unless they have the videos or they are following up or they ask a specific question and the person doesn't answer, then you know something is wrong. So that's something that parents have to also get used to, and then try to just limit during the class time. And then also give them, I give them at least an hour of social media and YouTube after school hours. So I definitely allow my kids to just use that, but also for a very specific time. The school is on the laptop, and then the digital media for social media is also on the phone or on the iPad. So we got to limit that also. And physical, that's definitely, I live in a gated community, so we have the possibility to immediately after classes just go out and then use the badminton court or the volleyball and stuff like that. But it is not also easy for the rest of the ones. So I think the physical reboot is absolutely necessary.
Yeah, good points there. Mrs. Pramila, do you want to add anything? You want to tell us how do you think we should take it forward here on?
Yeah, I agree with Mr. J. I feel physical work is very, very important. They have to go out. As it is, my son is going for flute classes and he's learning vocal. And I feel almost 8 hours of online classes every day is not it's a very big challenge, I feel. Even basically, I'm looking at him and he's like increasing in his weight also. And I'm very uncomfortable. I want him to go to offline, but I'm scared about this COVID-19. I don't want to send him. So you, like the great people like you, doctors and others, have to suggest me something about this, because everything is important in life. And I feel 2 years of this offline schooling, online schooling is, he has lost many things in his life, I feel. Interaction, and he is unable to connect with his friends also. They are digitally known, but not so personally. So in that way, I feel it's a big, I feel it's a disadvantage, yeah, because they are losing their age. And this is the age where they have to be very active outside. They should be physically fit. They have to enjoy their life. So in that way, I'm a bit uncomfortable with the online classes. But even to send him to school, I'm scared because of COVID-19.
Understand. Yeah.
Yeah, yeah.
But so there's one uniform thing that we are getting, which is to say that some kind of physical activity should be there amidst all the things. So we're taking that cue on as to what Usha, the teacher, has told us. We're going to have a break. And during this 20-second break, we're going to all do something which is physically active for all of us. So I'm going to do my stretches. Yeah, music on, Mayur. Okay, everybody stretch. Yay, that's done. Okay, so we'll now kind of summarize what we have discussed so far and then open up this session for everyone, okay, who has been here. There have been some very interesting things being shared in the chat as well. So a few things to just mention. One is, we all kind of agree that there are some positive things about the online schooling. We have identified some challenges. We've also come up with some expectations of how we are going to do for the future. I'm going to give like a couple of minutes to Dr. Shalini to tell us how should we resume the school, and then I'll hand it over to Usha after that to tell us how they're going to make some changes. So Dr. Shalini.
Okay. Yeah. Now I've been thinking about this, and at the right time, I found this article from ICMR published in Indian Express a couple of days ago. This is a sero survey that is checking of antibodies in the population. Indian Council of Medical Research has done this survey. It's the fourth sero survey that they've conducted in the last since the pandemic began. So this was done in June, July. And this was towards the end of the second wave that we had. About 28,000 people were tested. And they found that compared to January, December, where only 25% of people that they surveyed had antibodies, about 68% of the people had antibodies this time. It was not all of them had that they had COVID-19 or anything like that. They could have been in contact with them and never developed the disease, but developed the antibodies. So there were all kinds of the surveys. The sample was taken uniformly from infected and non-infected people and vaccinated ones. So they found that 68% of the population were positive for antibodies this time around in June, July. They even included kids from 6 to 17 years of age. And they found that between 6 and 9 years, 57% of the ones tested had antibodies. And between 10 and 17 years, about 61% of them had positive antibodies. Now, and also after first dose, about 81% of the people they tested had antibodies. And after the second dose, about 89%, so nearly 90% of them had developed antibodies. So this is quite an encouraging thing, I would say, compared to last year's data. This is the 4th survey they've done. And this data has been collected from urban and rural areas. So I would take this in a positive way and really use all our creativity and imagination to see how we can restart school. Perhaps in a staged way, perhaps in a partial way, perhaps in a class of 30, for example, they could probably attend class, 10 of them in one day, 2 days a week, 10 of them in the other 2 days, and 10 of them in the next 2 days. And plan the activities in such a way that, information can be disseminated online and other activities can be planned during the physical classes. Other activities, testing, tests, and perhaps doubt clearing and other interactive sessions can be planned on a physical classroom. So, we have to weigh the pros and cons, and as well as agree upon a very firm policy about how we are going to go about managing kids in school, how we are going to enforce the screening, and if somebody has some symptoms such as cold, cough, fever, or anything else, how we are going to go about testing them or isolating them. Across the world, schools have been started even, what they're doing is, if somebody has symptoms with or without testing, they are being isolated for 15 days and they come back to school, just to avoid the other kids getting infected, other kids and teachers. So this has been happening, and most kids seem to be tolerating this infection, even in the second wave. I don't think we had too many kids having a multisystem inflammatory disease as we were all hearing about it. I don't know the exact percentage, Dr. Sujatha might know, but out of the total number of kids infected, I don't think we had a massive number who had very serious illness. Most of them have tolerated the illness very well. At least all of my patients did. All the kids that I saw who were COVID positive tolerated it really well, except one tiny baby who required oxygen. And even that baby recovered really well. So my personal experience tells me that kids have been okay. However, we have to recognize that this virus is a mutating one. And what do we do with the next, if it mutates again? How are we going to deal with? So this is where a very strong, well-informed policy comes into picture by the school and parents. They have to be in agreement with what's going to happen if there is a case or if there is somebody who's got symptoms. And regular screening, proper methods of screening. So how do we test somebody's temperature, not on the forehead? How are we going to check their saturation in school, as part of screening? How often are we going to do it? And how do we educate kids to maintain distance, hygiene, hand washing? I think these could be, carried forward for many years, this education. So, a firm enforcement of these things, in a loving way will make kids, understand the importance of all this in their lives. Because if we do this, they will get their schooling back. They'll be able to go back to school if we do this correctly. This is, I think, a very challenging time for parents and teachers and managements of schools. But I think everyone should think about it in a very creative way and look at taking this forward.
Thank you. Usha, what do you think? Is the school set, ready?
Yeah. To be very frank, the schools are already setting up as per the guidelines of whatever the government is telling. So they are much prepared with the general hygiene condition inside the school campus, as well as the children now. They have already learned from their probably they say the home is the first school for their well-being. So it is like, totally they know how they are being leading this 1.5 years of life with especially sanitization, the social distancing and all. So these stuff we need not actually, probably we might, time and again tell them one or two times, but in the higher classes, probably we don't expect much problem from the kids. Only the lower school, probably we have to, be concerned about them regarding the hygiene part of it. Apart from that, the school is reducing the strength, keeping it on all alternate days or time management as a half a day up till 12, and after that up till 3, something like that. So it is like that. And then we are giving some activity based, projects and all interactions which are analytical based. Let them think, let them interact, let them know let them do some research, let them, Google and find out as to what they are expecting and all, and then the grade has been allotted. So all these things from the school end we have already prepared, and the chart and the way of guiding them and directing them for the best of the best knowledge that we can give from the school, we have already been prepared with.
Wonderful, wonderful. So lots of interesting inputs from the healthcare as well as from the, teaching fraternity as well, to make sure that our children are safe. We'll just open up. I think we have about 5 to 6 minutes opened up. So we'll be happy to take a couple of questions. Please remember that, this is not the end of it. We'll be happy to, interact with you again on the same topic. There'll be lots of questions, I'm sure. So I look forward to seeing some questions here. And parents, if you or other people who are on, you can switch on your video and audio and tell us if you have any questions. So it's been a very interesting discussion. I think the main thing is, should I be worried about sending my child to school? Should I be even worried to send them down to play? Because we've been having such restrictions. COVID is airborne. That's some of the queries that parents will have it. So let me just pick on what Dr. Shalini has told. One is the Zero survey gives us a lot of reassurance to say that many children are already exposed to COVID one way or the other. If they do get COVID illness, it's a mild type of illness. Majority of them recover very well. Okay, but there is a small percentage, about 2 to 10%, who may end up needing the hospitalization. That's as far as the children are concerned. Having said that, the recovery rate is also quite good with COVID in children. Okay, so that's something that I want you to take home with. However, I just want us all to be very, very cautious about the COVID etiquette. That is something that cannot go away from us. There's been a lot of good things that have happened because of it, which is basically we've seen very less number of hospitalizations because of flu-like illness. People are getting vaccinated on time and they're following these etiquettes, especially hand washing. So that has just raised the standards of the health of children significantly. One thing which is a serious concern is still the weight gain in children. There is something that is that we need to be very mindful about it. And as what many of the panelists here told us, physical activity, there is no substitute for it. and it doesn't matter. You can get as creative as you can to make sure that that physical activity happens to your child. And based on your child's activity, the diet should be given, So there's a lot of comfort eating that happens. So we've seen like good 5 to 6 kg gain in almost everybody on an average, every child from their previous hospital visit last year. So that's quite a significant weight gain. So just we need to be very, very mindful about that. Okay. And a few things that, once the unlocking happens, it's probably a good idea to just get a consultation to just figure out, where your child is in terms of their growth, their development, and also whether there is any eye issues, posture related issues. So things like that may need to be looked out for. Okay. So there's like a couple of questions that have been asked here. So Mr. Vishwas has asked us, what kind of balanced diet needs to be provided as kids are not having physical activities and no exposure to sunlight? Quite a right question. So one of the things that we generally recommend is you don't need to like buy the various supplements and then thrust it in your children. That's not going to prevent the COVID. But, a balanced diet is always something which is a healthy one, which has got 2/3, or rather at least half the plate full of fruits and vegetables. There is no shortcut for that at all. So try to make sure that the snacks and the, things are planned accordingly with lots of fruits and vegetables. You can get as creative as you can be. And I've seen almost everybody in their house has kind of gone into cooking in a big way. So yes, please do go ahead with that. That's a good thing. So I hope that answers your questions. So there is no fancy vitamin supplements and things like that that we would recommend. What is the next thing? Any progress on child COVID vaccination by Mr. Amit? Okay, as of now, the studies are still going on. I know 12 years and above, the vaccines are licensed, but that is not there in India yet. So hopefully we will be getting them. So the Moderna and things, the Pfizer vaccines are licensed for 12 years and above, but it's not yet available in India. But the Covaxin and the Covishield are being tested for 2 years and above. The number of children recruited for the studies is very interesting and challenging because most of the kids recruited were basically children of the doctors. That's what our healthcare teams. So people found it very hard to actually recruit children for these studies for the safety profile. And so far, of those that have been tested, the interim test is that it is still safe. That's what I can tell you. So that's the progress about the childhood vaccination. And then there's Mrs. Akriti asking us, can school take classes to make kids more comfortable with using laptops for lower grades? I think that's quite an interesting and a very important one. I'm sure we need to share that with the teachers as well to see how they can get things doing. Mr. Krishna has shared that in my daughter's class, a good thing is they have kept art class, PT class, and music class. It's a good thing. Excellent. Something about the network issues. Okay. Yeah. Okay. So it's been quite an interesting discussion getting the 360-degree view. I don't know whether Sophie is still on. So Sophie, you are going to have a final word. Okay. You've got to tell us how you want friends of yours to do in the online schooling. What are you going to tell them? One thing. You have to switch your audio on, beta.
As we have to improve in our education, also online classes must continue.
Oh, okay. Online classes must continue, but with a lot of fun in between. Yeah. And there'll be like lovely teachers like Usha who will actually help us in getting the curriculum streamlined And there'll be wonderful parents like Mrs. Pramila and Mr. Jai, who will make sure that the children are
Include music class.
music. Yes, absolutely. We'll do that. Okay. Sorry, Mr. Jai, you had something else to add on?
I just had one last word for Ms. Usha, the teacher. We have anyways disrupted the ways of learning as such. So even if we open up the physical education, I mean, the classes as such, let's just use the best of this online and disrupt the way we teach our kids as we go along. That's very important. The important and the most needful concept that needs physical presence is the only thing that we should do. And research-based studies, and then the group discussions and the physical experimentations for that matter. But the ones which can still be done online by using digital methods still be done in that way as such. So let the disruption be the way that we take this forward. Just an inspiration for you, Ms. Usha, because you're from the fraternity.
Thank you. Thank you so much. Thank you so much, sir.
And thanks so much, Dr. Sujatha, and also Dr. Shalini, for all these things. The frontline workers, you get a salute from me. Thank you so much for all this good work that you're doing.
Thank you all. So we'll wrap up on a good note as what Sophie told us and what Mr. Jai told us. And I thank each and every one of you for participating in this very important discussion on online schooling. We've had quite a few, inputs. We've had some learning points. We'll summarize all of that. And then, this will be shared in various platforms as well. So in case you want to refer to anything, please feel free to put in your comments. Our team at Aster, we will be looking into it and we'll try and address as many queries as possible. So on closing this session, I'd like us all to remember one thing. Let's have our online schooling and the regular schooling, but in a balanced way so that we get the best out of everybody, especially the children. And as what Sophie recommends, we'll make sure there's a lot of fun in it. Okay. And as what Usha has told, the teaching fraternity is all geared up for it. And we as parents, we should also be ready for it. And we at healthcare team are really, want to reassure the public that, it's important to make sure that your children are getting vaccinated properly. Make sure that if there are any specific concerns, consult your pediatrician. Make sure that problems such as the eyes or the vision, the concentration abilities, posture, and weight, these are looked at. Please make sure that you discuss these aspects with your pediatrician. And with that, I want to round up and I want to thank Aster RV Hospital Management for helping us in conducting such a fantastic series. Thanks to Mayur, who has been very good in organizing this session and giving us the wonderful music as well for our intermission breaks.
Thank you.
Thanks, Mayur, and he will still be the contact point for any queries you have. He'll be the person who will be uploading the sessions in various platforms as well. Thank you so much, everyone, for attending this session.
Thank you so much, Sujatha, Usha, and Shalini, Mr. Jai. Thank you so much for this session. It was wonderful, actually.
Thank you so much.
Yeah.
Thank you so much.
Thank you.
Yeah, thank you all.
Thank you so much, ma'am.
Thank you, Sophie. Bye-bye.